Integrative medicine to me really is looking at everything from the holistic approach, and it really starts for me from the heart space. What sings to me from the soul of a being, a person, and then really allowing myself to also be transparent in the process of what we're doing is work together. I don't believe that it's a separate journey, but it really is looking at how we bring about the environment that shapes the best healing for an individual. So I don't think there's just a cookie cutter or one way of doing that, but really looking at it from the indigenous perspective, from a spiritual place, from looking at the data that's available scientifically, and also looking at everything that's available holistically. Certainly, I don't think there's a plan that works just one way for one individual. It really has to be patient or client led, that they feel comfortable with all the steps and that they really know what is best for themselves. Like your body is really talking to you and screaming at you and yelling at you, and that response allows you to better embrace and support yourself with the resources that I'm able to share. So for some people that may be more internal, for some people that may be more external, and how they may incorporate new things with their diet, with reducing the level of stress in their workplace, or with people that are really causing them distress, and how that's showing up as disease in the body. And so that can be done through a lot of different healing modalities and practices. And we have everything on the earth in terms of herbal medicine, and through acupuncture, through dance as healing, through music as therapy and healing, and just really moving those things out of the body as toxicity. And so that cleansing process, I believe, happens through a lot of different ways. And it really has to be centered around what feels balancing for the individual, and then partnering with people that allow them the comfort and the environment that's important for them to be in. For somebody, that could be outside, that could be in a garden. For some people, they do feel more safe inside of places and having a bit more structure. So I think that's why there's a different personality for every single person, but it's really looking at the whole. I think a mutual acknowledgement of looking at all of the modalities as really being egalitarian, that it's very equal, that one level of knowledge does not negate someone else's level of knowledge. So for example, we may have doctors that are specialists in certain areas, and a shaman that's been born for a certain practice and what they're supposed to give and bring as healing medicine. So I think we have to see more of a bridging in accepting that everyone is a piece of this divine, amazing, beautiful experience, and a part of that universal puzzle. And so in really embracing that whole, again, is reshaping how we look at knowledge and information and that transference of it. I think we have to look strongly into more apprenticeship, getting back to some very ancient ways of sharing knowledge. It doesn't just need to happen in a classroom. It just doesn't always have to focus on being in a clinical practice or environment, but how we make that real and how we make that living. And that starts from babies, infancy, all the way up to elders, that there's always something that we can offer, something that we can learn, something that we can share, and that we have to get away from a lot of the titles, because so often it's like, well, I'm an Ayurvedic practitioner, or I'm a doctor of Oriental medicine, and at the end of the day, who cares? As long as people are healing and that you can see the results of that and they can feel the results of that, then we should be working as a whole towards coming together in practice under an umbrella that allows for growth to happen between providers. And I think that's really important, and where we have to start is really looking at one another and valuing the information that everyone brings to the table holistically.
Integrative medicine is medicine that incorporates mind, body, and spirit, so that the whole person's psyche and whatever else is going on is incorporated into the treatment. Well, what we're doing now in this conference is having a dialogue so that everyone in the medical field can at least know how to refer people to whatever might help them. So, we're all good at something, but sometimes what we're good at isn't what the person needs in their treatment. So, if we're educated in the options that we can refer people out and they can be healed, all aspects of them, instead of just getting a medication that suppresses their symptoms.
Integrative health to me means including the whole body, the body, mind, emotions, and soul, and especially the soul work is where I focus. It might be missing and not be integrated or not known. So, trusting our bodies, that our bodies give us information, and listening to our breath and listening to the vibrations, sensations, the feelings in our body make lots of answers revealed that don't seem to be known at the beginning.
So to me, integrative health is treating the person in a holistic way, and not just a body part, not just a one simple illness that's going on, whether that be acute or chronic, but treating, really the mind, body, and soul, and looking at the integration and the bridges and the gaps and the all of the relationship between those things, so that patient can be well and can live with good health and without illness. For me, that looks like combining Western medicine with the integrative medicine, the complementary medicine, whatever we want to call it, but all of these modalities and pulling them together in a space that allows that and allows the patient to have access and education. One of the big thoughts in my mind is that a lot of people don't even know about these other modalities, and we go to a traditional doctor or a Western medical emergency room, urgent care physician, because that's what we know, or that's what our insurance tells us that we need to do when we have a problem. And so starting with some education or some community health fairs or community knowledge about what these other things are and what they can do for the body and your overall well-being and your spirit, and to promote health and decrease illness. No, I think that the importance of why we're all here today really shows that we are making some progress in moving toward that way, and especially just speaking for myself, coming from a very, very Western medical model where you talk about the alternative or complementary medical models, and it's not looked highly upon. There's resistance, and so we have to figure out a way to bridge that gap with the resistance and join all of these worlds together. And hopefully in 10 years we're sitting here at the same conference, and there's 300 people rather than 30 people or whatever there are today. That maybe will become more of the norm. So that's my hope for it. And, that's the way that in my practice of medicine that I would like to see my practice kind of turning into as well.
Integrative health to me is like buying a pair of shoes. I want something that's going to last, something that's going to be comfortable, something that I like and that I will do all the time. Wear that same pair of shoes constantly. Having the information from my mind questions as well as my body feeling reflexes that is copacetic with what I want to gain, what I want the final outcome to be. I think it's a great way to explore what you're going to do with your body and what you're going to do with your mind and how it affects your soul for the rest of your life. And at the rate people are going and getting to live longer, I see it as a necessity. There's no other options unless you don't want to live very long.
I think to me, it would mean some sort of compromise with the biomedical model. The biomedical model has been the establishment upon which the medical institution has really gained prominence and dominance and authority. And currently, the way it's described is that it's very one-sided, cultural, one-size-fits-all. And that's problematic given the diversity of our country, the diversity of how we understand health and illness. And so I believe that the biomedical model has to compromise in some way to allow for different voices, especially marginalized voices, to kind of have a platform and legitimacy behind how they view and understand health and illness. And the extent that it's not just physical or something that we can measure, something that's objective, but something that's also experiential and something that we feel. Today we've heard a lot about the heart and a lot about our souls, and I think when we talk about health and medicine, we forget that we are a body, a mind, and a spirit together rather than just the body. The solution, I think, is naturally kind of happening because a lot of people are starting to get, dissuaded or starting to kind of challenge the biomedical model because it's not working. We have high rates of diabetes, high rates of cancer, high rates of arthritis, high rates of you name it. And disparities seem to be getting bigger rather than smaller. So if the biomedical model is working, then we would be seeing progress in some way. And unfortunately, I feel like what we're seeing is a lot of side effects from pharmacology, the use of pharmacology and the treatments of very high invasive surgeries that sometimes isn't always worth it. And we're starting to kind of have a discussion over the quality of life versus the actual disease itself. And sometimes it's the quality of life that we should be prioritizing instead of the addressment of the disease itself. Because I've seen many, or I've heard of many cases where people prefer not to have a surgery but have a better quality of life in the last month. Or vice versa, where they do decide to go into surgery, but then they are just incapacitated or just no longer functioning for the last remaining days of their life. And so I think we're at this conundrum where we have to think, what is health and illness, and what is our goal with medicine? And if our definition of medicine is to live longer despite anything, then I think we're doing a good job. But I think we're starting to challenge that mentality and say, I think good medicine is being able to know myself and being able to be healthy in a way that how I define to be healthy too. Because oftentimes I feel like with the biomedical model, we lose autonomy. And we heard it this morning with the session, is that we have the solutions with us the whole time. And sometimes we forget how much power we have within us to become better or to heal ourselves. And we often look externally for these solutions. And so part of it, the solution, is for people to no longer give up their power or give up that authority to their medical provider, but to start embracing and understanding themselves, understanding their bodies, listening to their bodies. And then challenging, we don't need all this processed food. We don't need to be watching TV all the time. And how do we get back in touch with ourselves to become healthier, and our families and communities too. I guess my remaining thought with integrative medicine is that we still need to look at the social political context, and sometimes we're afraid to talk about power and how communities, just because they're unhealthy doesn't mean that they make bad choices, but it's because we structurally have positioned themselves in a position where there are a lot more fast food areas in that place and a lot more expensive healthy vegetables. So I think structurally as a medical sociologist, we need to start looking at how we valued and how we create these communities in the first place, and start not blaming individuals so much and start to recognize how we can really transform space and just the structure of things in order to change individual behaviors. So,
to me, I was lucky in the sense that growing up in a Pakistani household, we did a lot of traditional healing using teas and herbs, and even more on the spiritual side, like cleansing ceremonies and ritual. And growing up with my grandparents, I was lucky they were around as well. So I had a lot of that coming just into me as a person, and then going into medicine in medical school, learning the very nuts and bolts and way things work at a microscopic level. And then moving through into, for me, I had an interest in nutrition. I kind of noticed I grew up eating very, I always ate at home, and we always ate very natural food, most of which we grew ourselves or knew where it was grown. And when I went to college and then medical school, I saw how kind of rare of an experience that was for other people. And when I was in medical school, I learned a little bit more about how nutrition could affect some of the other things we learned about, but there wasn't as much, not interest, but there just wasn't a lot there. It was kind of pushed off to the side because how could you pick one person versus another based on what they ate? No one would follow those exactly. You can't do a study, so I wouldn't worry about those things. But when I was applying for residency programs, I knew there was integrated practices that were available. I really liked the setup here in New Mexico. And going through it, and I'm about to graduate now, so I've had 3 years of being a practicing physician and being able to incorporate it more and more. I think the biggest thing is really looking at someone as a whole person. And it sounds cliche to say that, but as an MD, a doctor, when I see someone, I say, well, you have high blood pressure, so I'm going to give you this pill. And that works. I probably will give them the pill and their blood pressure will go down. But when I think about what's kind of a core value for me, it's what about your life has led to this? Or what about your life can we maybe alter that can improve your life, and you may or may not need this pill in the future. And a lot of that has to do with here in Albuquerque, where my clinic is, it's very health literally poor, and teaching people just what is a fresh vegetable, how do you use a fresh vegetable, how do you cook that, why is it different than a canned vegetable, and starting at those very basics where I didn't even know people didn't know those things, and having to go to that. And then when I'm able to go into just the basics of nutrition, I hear a lot about, well, I grew up as the person who, you know, there was no food at home. My parents weren't there, or very consistently, my parents were heroin addicts or drug addicts or alcoholics, and this just wasn't a part of what we did. And I thought I was doing really good just by not being addicted to something, which sometimes I end up being addicted to food. So that's an example of where looking at the whole person in a way, mentally, spiritually, and down to what they eat, has been, I think, really helpful in the patients that I've worked with, and even just growing our relationship together as a physician. But also, I think, overall, I'm getting an idea of the community I'm a part of, and that was something I didn't really include in integrative medicine, but it is a community way of looking at, I don't like the term problem, but if everyone in this community has diabetes, then we can work in a much bigger way to change that whole population and have a much healthier, happier growth. And I think for me, that's what it needs to be in integrative medicine, is to look at a whole group of people and see if we can improve the quality of their life through traditional medicine and all the other things that are included in that. So in our clinics, we have two. One is an integrative clinic that's a traditional setup, but it is very cost prohibitive to a lot of the people in Albuquerque. So where my personal clinic is in the Valley. There's not a lot of, they don't have a lot of liberal funds. A lot of them are either on disability or just have a very minimal amount. So me telling them to go get a massage or join a yoga class is just not something that's usually available to them. So what we've done is, in our clinic, we did a series of cooking presentations that were put on, and we did a little bit of, as the physician's education on the kind of, if it was high blood pressure, cooking with less salt. The rest of the time was with farmers who are from the Valley, who know those patients in the sense that they know where they came from, and talking to them and being like, well, because if I say broccoli, if I say broccoli, you know, they may not eat broccoli, they may eat chard. Chard is something that's a lot more commonly found. And the other thing is that we're bringing in we've brought mental health professionals into our clinics, so they have a resource. We also have community mental health workers that go out. So if we do have someone who's overwhelmed by even if they're an adult parent that's in the throes of a heroin addiction, that we can have a community health worker go and support our patient while they go through that, or provide safety for women who are in verbally or physically abusive relationship, or sometimes just know if, well, this person didn't come, they normally do, but we knew there was a different stressor in their life, and we can have those ways to bring them, either send people out to the community or have them come in and feel like they have a space to do those things. We're working a little bit more with trying to figure out a way to bring group classes like acupuncture to our clinic as well. Massage, there's a petition that they're doing right now to at least have insurance companies take a serious look at funding massage. Acupuncture is covered under some things, and they're hoping massage will be covered in the same. And also with yoga, having yoga at the clinic, whether it's through yoga teachers that will volunteer their time, or doing like a thing through a teaching kind of thing. So by being a center for where people can come and get access to that isn't cost prohibitive, I think is what it means in my current place of medicine.
A solution connotates an end, like a sum, and there's no end to it. It's a continuum. So maybe solution's the wrong question. But it really just takes grassroots people learning more about themselves and wanting more and asking more, demanding more, seeking more, and then the market will start to deliver it. Right now, we're pretty rooted in Western medicine because that's where the funding and the billing goes. And so that's where very highly educated, well-meaning, training people go get trained into this one dogma, but we don't reimburse or acknowledge much of the others in the same way. So you will go to where you get paid the most, even though maybe you want to do something else, you want to incorporate something else. So I walk both paths, and I work within an organization that's very completely the medical side for the most aspects, but then you can bring in micro bits of any alternative kind of medicine by offering that to your patients. But we don't have a lot of the funding to be able to allow them to go, so we have to find ways to do this because we can't separate that cost thing. So I really feel it's from the people who are seeking the insurances, seeking the health care, them demanding more and wanting more, and then the product will change because the people who want to make the money want that contract. So they'll be like, okay, if that's, you won't take mine because we don't have this, and you took that because they did, all of a sudden we're going to offer some massage, we're going to offer some acupuncture, part of our package. And that'll slowly change, and it does change. For example, my sister, she is in Canada. I originally come from Canada, so we have a single payer system here. We have a multi-payer system, and that's also part of the problem. But she, part of her, say she got a year off from maternity leave in Canada because that's what everybody has. She also gets massage, part of what she does. She gets to see a naturopath instead, alongside of Western medicine. And so it's already bridged there, and I think it was easier to get bridged there because of the single payer system in a lot of ways. We're kind of dividing ourselves by you see it in Albuquerque, all the billboards all over for all these different health plans because they're trying to buy your business. But if we could stop spending energy on buying people's business and just change that to providing care, we can fund money different ways.
So integrative health, that's interesting because I know all the right answers and I could give you kind of textbook definition, but I think, truly integrative health to me is remembering that everything becomes our health. So what our daily practice is, that becomes our health. So, if our daily practice is to get up and to have, donuts and coffee, well, that's the kind of health that we're asking for, right? And if we're asking for another type of health, well, what are we actually integrating into our own health? And so in the idea of traditional medicine and incorporating that, for myself,
if I was to say, oh, well, do you follow medicine? Do you have a medical provider? Some people would say no, because I don't go to Western doctors all the time, if that's their definition. But for me, every single practice that I do is also what makes my health. And so if I choose to look at something and I let it be medicine to me, if I look at a beautiful sunset and I allow that to be its own type of medicine for me, or driving across country to go see a concert, it can be the same thing. And what brings my heart joy, what brings my soul joy, and then also what do I do to take care of my body? Because as we know, it's not just like taking a supplement that's going to heal us. You can say, okay, well, take turmeric and that'll heal inflammation. But the truth is, if you eat anti-inflammatory foods or non-inflaming foods on a regular basis, including things like turmeric, you're going to have a lot better effort than if you're eating hamburgers and junk and then trying to take turmeric to balance things out. It's not quite the same, as the daily practice. And so truly integrative health is integrating your health. It's kind of the idea, right, of organics, right? If you ask my brother what are organics, he'd say weird hippie food that's not healthy for you. Because to him it's odd, it's different, it's not something that's normal. And so for him, looking at it, it's like his form of normal has said eating organics is expensive. It's reserved for people who are either, hippies or rich people that are kind of uppity, that are really concerned about the health, but also it has weird things in it because it's organic. Well, so part of it then is education, right? Helping to educate him. But just like that culture becomes a culture of normalcy, becomes normal to go to the store and get something that's full of pesticides, how is it that somebody could feel more confident getting something that's laden with pesticides because it's not labeled organic, which in some people's minds is the people's food, right? Non-organic means you're not an uppity kind of rich person. That's not the case, Truly, organics are getting back to nature, getting back to how our ancestors ate all of it. But it's that paradigm shift of saying like, okay, is this actually something that is good for me? Is this something not just for those people, but also for me, And I think that that's a lot of where the shift will change is if people can see themselves in the paradigm of health, then they feel like they're a part of it. But if they feel like they're excluded, if they say, well, I don't look like a tall, thin yogi, so I can't do yoga, that's not true. People of all body forms, of all body shapes. If you go to India, everybody's doing yoga. Tall, short, skinny, fat, it doesn't matter. It's the practice. But also that's what's normal there. So I think in part to make this something that is shifting and something that lasts for people is to say this is what we all do to take care of ourselves. Just like in Europe, they don't say, oh, did you go and exercise at the gym today? No, they say, did you get your workout? Did you get your walk today? It's like a different attitude about it where people just know that it's good for them. So they say, oh, did you do this for yourself? As opposed to, oh, the trudgery, did you go to the gym? As though it's some practice. So to make it a part of our own lives. I think that right now we're at the place where we have to make a change or our world is going to keep spiraling. And what we see now is there's so much sickness in the world. We find it in our foods, we find it in our air, we find it in our water. And in order to combat those things, it's not to say, fine, I give up, I'm just going to join the party and we're on a sinking ship. I think all of those daily struggles and daily efforts, it's going to take all of us being able to say, what are we doing together to keep our world healthy? Because it's not even just a matter of individual health right now, it's a matter of world health. And I think the more that we realize everybody's doing their part. I can't do everything, you can't do everything, but if all of us do our part, we'll make it through. I have faith in that.
Integrative medicine is looking at how we can become healthy people by using every means that we have available that is holistic and natural in nature, and finding out how we can combine the knowledge that we have from the ancestors and from the background of knowledge we have with herbs and with all of the things we can do to treat ourselves and others, and how we find that little bridge to go over to Western medicine and the training that people receive when they go to school to become doctors and nurses, and how we take East and West and ancestral knowledge and fuse them together to bring about the best results for the individual, and that impacts the entire family and the community, and in the end, the world. So if we can look at integrating our own health first, meaning that we want to find out how we can take responsibility for our mind, our bodies, and our spirits. And once we take responsibility for that and understand that it is first and foremost our responsibility, then we can move forward with seeking the kinds of support that we need from others. And that would include the curanderas and practicing that particular profession and trade and ancient system, and all of the people who are out there providing healing opportunities. Some people would say the shaman, or it could be someone that just naturally practiced that, like a grandma in a kitchen who just knew what herbs to get when baby was sick, when baby had a fever, how to bring that fever down by knowing their natural environment and the herbs that they were growing or having access to. So we have to first look at self, and then we have to look at how we utilize the people around us, and then how we integrate, like I say, the people that have been trained with Western understandings to help us to move forward and not look at surgery as necessarily a first option, or archaic ways of treating women and children and others when we look at health and health care. I think that one of the channels and avenues to finding a pathway into integrative medicine is to first of all accept the fact that we do need to integrate. That's the first thing. So we need to have conversations, dialogue with people who care and are in the field, and make it become table conversation, comfortable table conversation. And I think that one of the bridges is to not look at it as just being confrontational, because whenever you alienate people from a subject or a topic and you make them feel like their practice isn't worthwhile at all, then it's very difficult to get across that bridge if you blow it up before you even begin to cross. So you can't just run out there with your dynamite and your TNT and everything and be like, all right, so I'm not gonna blow everything up and then just do what I do and start all over, because you'd be at war, because those people aren't going to go away. The Eastern people aren't going to go away anytime soon, nor are the people who are trained in the West with Western medicine. So we have to find that pathway to open up dialogue first and foremost, and then to provide more classes and class structure where this kind of teaching can be taught, like the naturopathic institutions that are out there that have well-trained and highly trained educators to give that information, or all of these kinds of organizations that are over the medical field to be able to approve, like it would be the FDA. I guess it's the FDA approves medicines and so forth that we can take. So there needs to be an understanding that many of these organizations that would ordinarily not want to see, let's say, a particular herb be approved, be able to understand that there's a reason to allow people to integrate that medicine into their lifestyles. And for some people that might be marijuana, and finding the different ways to use marijuana. I've never smoked marijuana, I'm not a marijuana smoker, but I understand that it has medicinal uses and purposes. It's not just Rastafarians smoking the ganja and being irie. You know, there's actual health aspects to it. So once we get there and we begin to offer this information in our institutions and legitimize it, then we can begin to say, all right, here's the way in which people can be trained and be accepted, certified, and so forth, so that the lawsuits are lessened and so forth, because let's face it, Americans are lawsuit happy, and be able to feel comfortable to provide the herbs and the combinations of herbs and other kinds of natural medicines that will help people with modern medicine. Because as much as we would like to resolve everything that we could possibly resolve with natural healing remedies, sometimes it's necessary to see a surgeon and have something removed, something dealt with in a way that seems intrusive. Sometimes there's no other choice. And being able to understand and respect that you have information and I have information. And together we can walk across that bridge, we can skip across the bridge, we can stroll across the bridge, we can saunter across the bridge. But the point is to get on the bridge and start walking, okay? If you have to crawl at first, crawl. You know, babies crawl at first, and then make your way. Make your way across that bridge so you can understand the bridging of ideas, right? Because everybody really benefits when people come together and they can utilize the best knowledge that is there on each part. So that's one of the ways in which we can begin to integrate. And then we have to let people understand and help people to understand that it's not a place to fear, because fear stops people from doing a whole lot of things. Just fear itself. And to be able to say, walk boldly and proudly and with faith and belief that you can find solutions to your concerns and then make them available, the solutions available, and make them affordable. Affordable.